1977 that I started private practice, but practicing medicine since 1969. Just before 2005, maybe for 2, 3 years, we had started using some electronic medical records. In old days, I would look in the chart. I didn't find a document, let's say path report. Um, Now I was asking secretaries whether they had them in the file, in the mail. If they didn't have them, then that meant call the pathologist, call the hospital or wherever the specimen was. And now I waited for them to fax it because the patient was now antsy, wanted to know what was the result. So overall, that took a long time. Now I look in the electronic medical records, see whether the path report is there, because if the girls have the path report, they scan it in. It's already there. Or I can just go into database and look at the CAT scan of some patient. I don't have to wait for the scan now to come or the report to come and the films to come. Overall, a lot of time saving, much more efficient, um, less waste of time, and good for both the person who actually generates the report and person who receives it. At first, you don't want to change because you're used to certain things. But once you have done that, and once you find the easier way of doing things, and you find your way, sort of to say, in electronic records, it's much better to do electronic records and easier to do it. Time is saved, and you see the patients quicker. So overall, yes, much better. We had 3, 4 offices, and going from one to the next, and the patient followed you. You had a hard time getting the records. Now your paper record was in one office, and patient was in the other. So that way, these records or the electronic records are much superior. Absolutely, in these medical records that electronic medical records that we have, uh, you have notes, your own findings. You have notes of the personnel if the patient calls while you were not there. There are prescription notes, complaint notes, letters if they come from patients. Also, you have x-rays, labs, everything can be scanned in and it's right there. Uh, for it's even the CAT scan uh, can be looked at. That's greatest. At first, when I e-prescribed, I always second guessed and thought, does it really go there to the pharmacy? And of course, it works out great because I still remember from old days, how the pharmacist would look at the your prescription and call back and he didn't know what you wrote. I still remember patient going there and staying at the pharmacy for an hour or two just to get his prescription. Now it's already there, and pharmacies, the best thing is the pharmacists accept them this way, and that's greatest because you're saving time for the patient and for you. You don't have to write these prescriptions; they're already gone to the pharmacy. the templates are great that we have in this, and that you're able to form these templates. That's a great feature to it. Um, ENT wise, I have not found anything that I was missing on these chartings, on the charts. Much better. My personnel in old days used to get frustrated trying to read my handwriting. For example, it was just a terrible situation for them. Um, Also, the advantage is our personnel is usually younger people, and they are very tuned to electronics and and finding their way in the system itself. They do that very well. So two ways. They are much happier, and you're happy that they are there to show you sometimes how to find things in the records. So that works out very well. Actually, they are very happy. Well, it's a great system, and I think very efficient, time saving, and I think I have worked with maybe another system a while ago, but I think this is a much better modified system than the time before. So you can modify, you can build your templates, and you can make it easier for yourself. Definitely, I would say everybody should have it.